Hello, this is Dr. Virginia von Schaefer, and I'm here to talk to you today to answer a commonly asked question: what should I do when I get first diagnosed with a cancer? What are my first steps? First of all, I like to advise patients the number one thing is to remain calm. The traditional world, really, when you're told the diagnosis of cancer, it strikes fear in everyone's heart. And fear is an emotion that actually makes things worse, not better. So the best approach to take is be calm and get more information, and don't rush into anything. Yes, there are certain situations where immediate attention is required. You may come to the hospital and have abdominal pain and then find out you have stage 4 pancreatic cancer. Okay, it's true. However, there are other situations where you don't need to rush and you don't need to panic. Basically, you want to get more information. I always advise patients to go see their oncologist or the surgeon, whoever is recommended to them, to see what the options are and what they're advised to do. And I like to consult with patients at this early phase because I can help advise people as to what I've seen works and doesn't work for people in the varying stages of cancer and varying stages of diagnosis at the time. We need to always be mindful of that because there are different alternatives that you can have depending on your different stage. Many times patients will require more information. I always like to evaluate people fully and get an idea of what their endocrine balance is, what their viral titers are, and things like that, because these are all confounding factors that may or may not impair your progress or even your initial treatment. At the same time, sometimes patients, if they're advised to have a surgery, they can undergo a small amount of preoperative optimization for their immune system and blocking tumor cell migration and invasion in other areas of the body, so that when they do undergo surgery, it's contained and it's only in one area. So my best advice is work on getting some more information, consult with all of the specialists that you have been advised to see, and consider getting a second opinion with myself or someone like me who can advise you as to what your other options are. Many of the patients I treat choose to have traditional chemotherapy and then some adjunctive treatments to boost their immune system alongside of it. And this is all possible. Of course, I treat many people with everything, every modality, depending on what their desires are and what their projected budget is. So we have to kind of gauge everything according to your particular needs. And in a state of fear and panic, it's hard to take a deep breath and just realize it takes about 10 years for a tumor 1 centimeter in diameter to develop. So there's something that's been going on for a long time, and you have time to figure out what you need to do and what's going to be best for you. So that's my best advice. Thank you.